18,000 new cases of COVID-19 here in France over the past 24 hours. Health Minister Olivier Véran says the situation now is unprecedented.
Je viens d'avoir les chiffres de contamination des dernières 24 heures dans notre pays. J'avais parlé des risques d'avoir 15 ou 20 000 cas par jour à la fin du mois de juillet. Nous étions hier à 18 000 contaminations sur 24 heures seulement. Cela veut dire que nous avons une augmentation de la circulation du virus de l'ordre de 150% sur une semaine. Nous n'avons jamais connu cela, ni avec le Covid, ni avec le variant anglais, ni avec le sud-africain, ni avec le brésilien.
A 150% increase in cases, says Olivier Véran. Let's get the analysis. Sterghios Moschos is Associate Professor of Virology at the University of Northumbria, joining us now live. Good evening to you, sir. What do you make of the words of Olivier Véran there about this 150% increase and the severity of the situation facing France right now?
I'm not speaking for France specifically. I think what we need to be very clear about is that this is a danger for the entire world. We are not, and I'm not exaggerating this, we saw what happened in India in the first part of 2021, where the Delta variant rampaged through the country and politicians weren't paying attention, let alone the public. Bodies were floating down the Ganges. 4 million extra deaths happened in that country all the way to June 2021. The main thing that makes the difference is whether or not people have been vaccinated. If they are going to be vaccinated when Delta comes knocking on the door, the chances of ending up in hospital or dead are going to be very, very markedly reduced. But it doesn't stop there. We really need to do our best as individuals, as companies, as countries, as unions to basically stop transmission as quickly and as aggressively as possible. This is the perfect situation a virologist could ask to evolve a virus to resist any kind of treatment, such as a vaccine. And unfortunately, we're hurtling down that pathway at galloping speed.
Let's just spell this out for people, and I'll give you a personal story here, Sterghios. My daughter is 20 years old. She's double vaccinated. She has caught the Delta variant living in London. What you're saying is that vaccination doesn't guarantee you won't catch a variant or whatever's happening with the COVID developments.
Absolutely not. A vaccination at the individual level doesn't guarantee absolutely anything, because I can't tell you how each individual's background, health, lifestyle choices, etc., will affect the chances of them getting bad disease or not. But what we know from the data, for example, from Israel or from Malta, is that where we would normally see huge numbers of people in hospital, even in the UK, or dead, we don't see them. And why is that? That's because they've been vaccinated and they're being protected from the severe aspects of this disease. That is not to say that individuals like your daughter who have not been vaccinated, who have received one dose only, are going to fare the same. In fact, that's exactly the populations we are seeing in the hospitals right now. And it doesn't discriminate about age. Younger people, children are ending up in hospital and in ICU, and we will see inexorably deaths rise. This is the way viruses work. What we are doing now is giving the virus the opportunity to adapt to this population.
And that will mean, what, more variants to come, do you think?
Well, first of all, it will mean that we will see a lot more younger people in hospital and potentially dead and in ICU. It will also mean that the virus will try to adapt and therefore develop new variants. Whether or not it will adapt to be resistant to the vaccine, well, that will depend on how much opportunity it has to encounter people who are vaccinated. That's how evolution works. And once it's encountered these people, if it catches a foothold in a few of them, then it's a question of transmission. Now, Britain is making the catastrophic mistake of basically saying, oh, we're just not going to bother anymore with pings and trying to stop the transmission by so-called non-pharmaceutical interventions. And we're going to end up in a situation where we give the virus the opportunity to evolve resistance to the vaccine. It's almost mathematically inevitable.
So it's the medically serious thing to do then is to continue with the restrictions, continue with the advice to socially distance, all the things that people have been urged to do. And the idea of having this Freedom Day, as the UK did, or rather England did, on Monday, is a very bad idea.
It's not a freedom day, it's a failure day. And the government went out and said it would be a success if there were 25,000 dead in this pandemic. We're already clocking 153,000 dead. The other numbers are equally as deprecating of the performance of the management of this pandemic. Now, a lot of us were saying at the beginning, you're not doing the right thing. We were saying it in May last year, we were saying it in September last year, we were saying it in January this year, we're saying it now. This is a wrong, catastrophic, unethical decision. We are putting people at risk. We are putting families, businesses, economy at risk, and the rest of the planet at risk. This is not the right decision by any means whatsoever. And estimations that we may get a bigger wave in autumn, etc., unfortunately, these are just estimations. The facts speak for themselves, where the ambulances are starting to basically declare major incidents, when ICUs are starting to fill up. Unfortunately, that is what the situation is.
And as the hard facts show, Sterghios Moschos, 150% increase of cases in France, 50,000 cases a day, thereabouts in the UK right now. Clearly, what you're saying is on the right lines. Thank you, sir, very much for sharing your analysis with us. Let's hope that the people who make decisions, politicians, are taking heed. We, of course, will continue to reflect all aspects of the COVID-19 story as it develops.